Boxer dogs and anesthesia, understanding risks and precautions. Boxer dogs are a beloved breed known for their playful nature and distinctive physical features. However, when it comes to anesthesia, boxers require special attention due to their unique anatomical and physiological characteristics. This video delves into the risks and precautions associated with administering anesthesia to boxer dogs, shedding light on the importance of understanding their specific needs. Boxer dogs have a brachycephalic, short-muzzled, facial structure, which can pose challenges during anesthesia. This breed is more susceptible to brachycephalic airway syndrome, a condition that affects their breathing. During anesthesia, boxers with this syndrome may experience difficulties in breathing and an increased risk of airway obstruction. Therefore, it is crucial to closely monitor their breathing and take preventive measures to minimize the risk of complications. In addition to their airway concerns, boxer dogs may also exhibit heightened sensitivity to certain drugs commonly used during anesthesia. This means that they may be more prone to adverse reactions or complications. As responsible pet owners and veterinarians, it is essential to be aware of these sensitivities and take appropriate precautions to ensure the well-being of boxer dogs during anesthesia. Anatomy and physiology of boxer dogs. Anatomy and physiology of boxer dogs. Boxer dogs possess unique anatomical and physiological characteristics that require special attention when it comes to anesthesia. Understanding these features is crucial to ensuring their safety and well-being during medical procedures. Firstly, boxer dogs have a brachycephalic skull shape, meaning they have a short and broad head with a flattened face. This distinctive feature can lead to a condition known as brachycephalic airway syndrome. This syndrome can result in breathing difficulties and an increased risk of airway obstruction, especially when undergoing anesthesia. Additionally, boxer dogs have a relatively large tongue, which can further contribute to airway complications during anesthesia. The tongue may obstruct the airway or cause difficulties in intubation, making it essential for veterinarians to take extra precautions to ensure proper breathing throughout the procedure. Furthermore, boxer dogs have a deep chest and a high prevalence of a condition called gastric dilatation volvulus, GDV, commonly known as bloat. GDV occurs when the stomach twists and becomes distended with gas, which can be life-threatening. Anesthesia can potentially increase the risk of GDV in boxer dogs, necessitating careful monitoring and preventive measures. Lastly, boxer dogs have a higher sensitivity to certain drugs commonly used during anesthesia. This increased sensitivity can lead to a higher risk of adverse reactions, making it crucial for veterinarians to choose the appropriate anesthetic agents and dosages for boxer dogs. In summary, the unique anatomical and physiological characteristics of boxer dogs, such as their brachycephalic skull shape, large tongue, deep chest, and drug sensitivities, make them more susceptible to certain risks and complications during anesthesia. By understanding these factors, veterinarians can take the necessary precautions to ensure the safety and well-being of boxer dogs undergoing anesthesia. Potential risks of anesthesia in boxer dogs. Potential risks of anesthesia in boxer dogs. When it comes to administering anesthesia to boxer dogs, it is crucial to be aware of the potential risks and complications that they may face. Boxer dogs have unique anatomical and physiological characteristics that can make them more susceptible to certain challenges during anesthesia. One of the risks that boxer dogs may encounter is brachycephalic airway syndrome. This condition is common in breeds with short noses, like boxers, and can cause difficulties in breathing. During anesthesia, boxer dogs with brachycephalic airway syndrome may experience an increased risk of airway obstruction, which can be life-threatening if not properly managed. Additionally, boxer dogs may have an increased sensitivity to certain drugs commonly used during anesthesia. This means that they may be more prone to adverse reactions or complications when exposed to these medications. It is essential for veterinarians and anesthesiologists to be aware of this sensitivity and take appropriate precautions to ensure the safety of the dog. By understanding these potential risks and complications, veterinary professionals can develop tailored anesthetic plans and take necessary precautions to minimize the chances of complications and optimize the safety of boxer dogs during anesthesia. Brachycephalic airway syndrome. Boxer dogs with brachycephalic airway syndrome may face unique challenges during anesthesia. This syndrome is characterized by anatomical abnormalities in the upper airway, which can result in difficulties in breathing and an increased risk of airway obstruction. The shortened skull and flattened face of boxer dogs contribute to the development of this syndrome, making them more susceptible to respiratory issues. During anesthesia, the compromised airway of boxer dogs with brachycephalic airway syndrome can become further compromised, leading to potential complications. The use of anesthesia can cause the airway to narrow, making it more difficult for these dogs to breathe. This can result in decreased oxygen levels and increased carbon dioxide levels in the blood, which can have serious consequences for the dog's overall health. To mitigate these risks, it is crucial to carefully monitor boxer dogs with brachycephalic airway syndrome during anesthesia. Continuous monitoring of vital signs such as heart rate, respiratory rate, and oxygen saturation is essential to ensure the dog's well-being. Additionally, maintaining body temperature within a normal range is important, as a drop in body temperature can further compromise the dog's respiratory function. Impact of anesthesia on breathing. Anesthesia can have a significant impact on the breathing of boxer dogs with brachycephalic airway syndrome. This is because the unique anatomical features of boxer dogs, such as their short snouts and narrow airways, make them more susceptible to breathing difficulties. During anesthesia, boxer dogs may experience a decrease in their ability to breathe properly. The anesthesia can relax the muscles in their airways, causing them to become more narrow and potentially leading to airway obstruction. This can result in reduced oxygen intake and increased carbon dioxide buildup in the body. Therefore, it is crucial to carefully monitor the breathing of boxer dogs with brachycephalic airway syndrome during anesthesia. Veterinarians and veterinary technicians should closely observe their respiratory rate, depth of breathing, and any signs of respiratory distress. This allows for immediate intervention if any breathing issues arise. In addition to monitoring, supportive care should also be provided to maintain optimal breathing during the procedure. This may include the use of supplemental oxygen to ensure adequate oxygenation, as well as the administration of medications to help open up the airways and improve breathing. By closely monitoring the breathing of boxer dogs with brachycephalic airway syndrome and providing appropriate support, veterinarians can help minimize the risks associated with anesthesia and ensure the safety and well-being of these unique dogs. Preventing airway obstruction. When administering anesthesia to boxer dogs with brachycephalic airway syndrome, it is crucial to take specific precautions and employ techniques that can help minimize the risk of airway obstruction. This condition, characterized by narrowed airways and difficulty breathing, can pose challenges during anesthesia. By implementing the following measures, veterinarians can ensure the safety and well-being of boxer dogs undergoing anesthesia. Thorough pre-anesthetic assessment. Before the procedure, a comprehensive evaluation of the dog's airway should be conducted. This assessment can help identify any pre-existing obstructions or abnormalities that may increase the risk of complications during anesthesia. Appropriate anesthetic protocol. Choosing the right anesthetic drugs and techniques is crucial in minimizing the risk of airway obstruction. Certain medications, such as opioids and muscle relaxants, should be used with caution as they can further compromise the airway. Your veterinarian will select the most suitable anesthetic protocol for your boxer dog's specific needs. Endotracheal intubation. The use of an endotracheal tube during anesthesia helps maintain an open airway and ensures proper oxygenation. This technique is especially important in boxer dogs with brachycephalic airway syndrome, as it helps prevent airway collapse and obstruction. Constant monitoring. Continuous monitoring of vital signs, including heart rate, blood pressure, and oxygen levels, is essential during anesthesia. Any signs of airway obstruction, such as increased respiratory effort or decreased oxygen saturation, should be promptly addressed. Temperature regulation. Boxer dogs with brachycephalic airway syndrome are more prone to heat intolerance. Maintaining a stable body temperature during anesthesia is crucial to prevent further respiratory distress and potential airway complications. By following these precautions and techniques, veterinarians can significantly reduce the risk of airway obstruction in boxer dogs with brachycephalic airway syndrome during anesthesia. It is important to remember that each dog is unique, and an individualized approach should be taken to ensure the safest possible outcome. Drug sensitivities in boxer dogs. When it comes to administering anesthesia to boxer dogs, it is crucial to be aware of their specific drug sensitivities. Boxer dogs may have a higher risk of adverse reactions to certain medications commonly used during anesthesia. This is primarily due to their unique physiological characteristics and metabolism. One of the medications that boxer dogs may be more sensitive to is acepromazine, a sedative commonly used in veterinary medicine. While this medication is generally safe for most dogs, boxers have been found to have a higher risk of experiencing adverse reactions, such as low blood pressure and prolonged sedation. In addition to acepromazine, boxer dogs may also have a higher sensitivity to opioids, such as morphine or fentanyl. These medications are often used for pain management during and after surgery. However, boxers may require lower doses or alternative pain medications to avoid potential side effects, such as respiratory depression or excessive sedation. It is important for veterinarians and anesthesiologists to carefully consider the drug choices and dosages when administering anesthesia to boxer dogs. Individualized anesthetic plans should be developed based on each dog's specific needs and medical history. This can help minimize the risk of adverse reactions and ensure the safety and well-being of these beloved pets. Precautions and safety measures. When it comes to administering anesthesia to boxer dogs, it is crucial to take certain precautions and safety measures to minimize risks and ensure their well-being. Boxer dogs have unique anatomical and physiological characteristics that make them more susceptible to certain complications during anesthesia. By following these precautions and safety measures, you can help ensure a safe and successful anesthesia experience for your boxer dog. 1. Pre-anesthetic evaluation. Before administering anesthesia, it is important to conduct a thorough pre-anesthetic evaluation of your boxer dog. This evaluation may include a physical examination, blood work, and other diagnostic tests to assess your dog's overall health and identify any underlying conditions that may increase the risks associated with anesthesia. 2. Anesthetic protocol. The choice of anesthetic drugs and protocols should be carefully considered for boxer dogs. Due to their sensitivities, certain medications commonly used during anesthesia may pose a higher risk of adverse reactions. It is essential to use drugs that are safe for boxer dogs and monitor their response closely throughout the procedure. 3. Monitoring vital signs. Continuous monitoring of vital signs is crucial during anesthesia to ensure the well-being of boxer dogs. This includes monitoring heart rate, respiratory rate, blood pressure, oxygen saturation, and body temperature. Any abnormalities should be promptly addressed to prevent complications. For maintaining body temperature, boxer dogs are prone to hypothermia during anesthesia, which can lead to complications. It is important to maintain their body temperature using warming devices such as blankets or warming pads. This helps prevent hypothermia and promotes a smoother recovery. 5. Experienced veterinary team. Anesthesia should always be administered by a skilled and experienced veterinary team. They have the knowledge and expertise to handle potential complications and emergencies that may arise during the procedure. Their presence ensures that your boxer dog receives the best possible care. 6. Post-anesthetic care. After the anesthesia, your boxer dog will require careful monitoring during the recovery period. This includes observing their vital signs, ensuring a comfortable and quiet environment, and providing appropriate pain management. Following the post-anesthetic care instructions provided by your veterinarian is crucial for a smooth recovery. By following these precautions and safety measures, you can help minimize the risks associated with anesthesia in boxer dogs and ensure their well-being throughout the procedure. Remember, the safety and comfort of your boxer dog should always be the top priority when it comes to administering anesthesia. Individualized anesthetic plans. When it comes to administering anesthesia to boxer dogs, one size does not fit all. Each boxer dog is unique and may have specific needs and medical history that need to be taken into consideration. That's why it is crucial to tailor anesthetic plans to each individual boxer dog to mitigate potential risks and optimize safety. By customizing the anesthetic plan, veterinarians can ensure that the dosage and type of anesthesia used are appropriate for the specific boxer dog. Factors such as age, weight, overall health, and any pre-existing conditions should be carefully evaluated before proceeding with anesthesia. Additionally, the medical history of the boxer dog should be thoroughly reviewed. This includes any previous adverse reactions to anesthesia or medications, as well as any known sensitivities or allergies. By understanding the dog's medical background, veterinarians can make informed decisions and choose the most suitable anesthetic agents. Furthermore, close communication between the veterinarian and the dog's owner is essential. Owners should provide detailed information about their boxer dog's health and any concerns they may have. This collaboration ensures that the anesthetic plan takes into account the dog's specific needs and minimizes potential risks. Overall, individualized anesthetic plans play a vital role in the safe administration of anesthesia to boxer dogs. By tailoring the plan to the dog's specific needs and medical history, veterinarians can mitigate potential risks and optimize the safety and well-being of these beloved pets. Monitoring and support during anesthesia. During anesthesia, continuous monitoring and supportive care play a vital role in ensuring the well-being of boxer dogs. Close observation of vital signs and maintaining body temperature are crucial aspects of this monitoring and support. Monitoring the vital signs of a boxer dog undergoing anesthesia is essential for early detection of any potential complications or adverse reactions. This includes monitoring heart rate, blood pressure, oxygen saturation levels, and respiratory rate. By closely observing these vital signs, veterinarians can intervene promptly if any abnormalities arise, ensuring the safety of the dog throughout the procedure. In addition to vital sign monitoring, maintaining body temperature is another critical aspect of supporting a boxer dog during anesthesia. Boxer dogs are more susceptible to hypothermia due to their short coats and relatively low body fat. Hypothermia can lead to complications, such as delayed recovery and increased risk of infection. To prevent this, veterinarians use various techniques to keep the dog's body temperature within a safe range, such as using warming blankets or adjusting the temperature of the operating room. Furthermore, continuous monitoring and supportive care also involve keeping a close eye on the dog's overall condition and well-being. This includes assessing the depth of anesthesia, ensuring proper oxygenation, and providing adequate pain management. By closely monitoring and providing necessary support, veterinarians can minimize risks and optimize the safety and comfort of boxer dogs during anesthesia. Anatomy and physiology of boxer dogs. Boxer dogs are known for their unique anatomical and physiological characteristics, which can impact their response to anesthesia. Understanding these features is crucial for veterinarians and pet owners to ensure the safety and well-being of boxer dogs during surgical procedures. One of the key anatomical traits of boxer dogs is their brachycephalic airway syndrome. This condition is characterized by a shortened skull and narrowed air passages, making it more challenging for them to breathe properly. During anesthesia, this can pose significant risks, as the effects of anesthesia can further compromise their already compromised airways. In addition to their airway structure, boxer dogs may also have increased sensitivity to certain drugs commonly used during anesthesia. This means they may be more prone to adverse reactions or side effects from these medications. It is essential for veterinarians to be aware of these sensitivities and adjust the anesthetic plan accordingly to minimize potential risks. To ensure the safety of boxer dogs during anesthesia, careful monitoring and support are crucial. Continuous monitoring of vital signs, such as heart rate, blood pressure, and oxygen levels, allows veterinarians to detect any abnormalities or complications promptly. Maintaining body temperature is also important, as boxer dogs can be prone to hypothermia during anesthesia. In summary, the unique anatomy and physiology of boxer dogs require special attention and precautions when administering anesthesia. By understanding these risks and taking appropriate measures, veterinarians can ensure the well-being of boxer dogs and minimize any potential complications.